outbreaks in high-risk settings such as hospitals and long-term care homes. Our wastewater surveillance is still showing the majority of sites in the province have downward or stable trends in SARS-CoV-2 detections, although we continue to see some regional variation, especially in the north, and are monitoring fluctuations in this data. With the peak of Omicron behind us, Ontario has been able to cautiously and gradually move through its reopening milestones. We are now learning to live with and manage COVID-19 for the long term. This necessitates a shift to a more balanced response to the pandemic, and changes are being made with respect to the province's pandemic response to reflect a longer-term approach. Le pic du variant Omicron étant derrière nous, l'Ontario a pu franchir prudemment et progressivement les étapes et son confinement. En poursuivant sur cette voie, nous sommes en mesure d'adopter une approche plus équilibrée et à long terme de l'intervention de l'Ontario visant à faire face à la pandémie. With continued improvements in trends, Ontario will remove the mandatory masking requirement for most settings on March 21st, with the exception of select settings such as public transit, healthcare settings, long-term care homes, and high-risk congregate care settings. Removing the mask mandate does not mean the risk is gone. COVID-19 transmission is still occurring across the province, and masks can help protect you and others from becoming infected with COVID-19. In fact, we can expect indicators such as cases and hospitalizations to increase slightly as Ontario increasingly interacts with one another. However, thanks to our high vaccination rates and natural immunity that is developing, as well as the arrival of other therapeutics and antivirals, Ontario has the tools necessary to manage the impacts of this virus. For those most vulnerable to the virus, it is still strongly recommended that you continue to wear a mask. And please continue to respect the masking requirements that remain in place, such as federal requirements for returning international travelers. As a society, I am asking that we remain kind, considerate, and respectful towards those who continue to choose to wear a mask. And we should all be prepared that we may need to resume mask wearing if a new variant of concern emerges, or potentially during the winter months when COVID and other respiratory viruses are likely to circulate again. On Tuesday, March 1st, I revoked the instructions for mandatory COVID-19 vaccination policies for the Ontario Public Service and for post-secondary institutions. A process is now underway to gradually revoke all directives and instructions by the end of April, with a focus on moving away from emergency measures to ongoing operations, moving away from reliance on provincial emergency direction through mandatory requirements, providing consistent guidance both across and within sectors, and ensuring support for the most vulnerable are removed last, and lifting of measures in a coordinated fashion. For case and contact management, I want to spend a moment to go over some of the changes that have been made in our approach to case and contact management and isolation requirements. The guidelines are being updated to minimize the burden on workers and families while ensuring our highest risk settings continue to be protected. The changes include updating isolation recommendations for household members and close contacts of individuals who test positive for COVID-19 or have symptoms of COVID-19. Previously, everyone in the household of someone who was sick or had tested positive had to stay home as well. With these new changes, household members do not have to stay at home if they are 18 years or older and have already received their booster dose, or if they are 18 years of age and under and are fully vaccinated. These household members still need to wear a mask outside the house and avoid vulnerable people in high-risk settings like long-term care homes for 10 days, but they can continue to go into work and or school as long as they're asymptomatic. For those non-household members who have been in close contact with someone with COVID-19, you are no longer required to self-isolate regardless of your vaccination status. You do have to self-monitor for 10 days, wear a mask when outside the house, avoid activities where mask removal would be necessary, and avoid vulnerable individuals in high-risk settings like hospitals. These requirements for masking or of recovering cases and contacts still apply when there are no longer masking requirements in the general community. If you have symptoms of COVID-19, you still need to isolate right away and get tested via a PCR if eligible or rapid antigen test if you have access to one. For those who choose to get boosted, not only are you better protected from COVID-19, but as long as you do not have any symptoms, you are no longer needed to isolate if someone in your household is sick. For education, as we continue to ease public health measures, we are also working with the Ministry of Education to align measures in schools and childcare with those in the community as much as possible. And as of March 21st, schools and childcare providers will no longer be required to conduct on-site verification of screening for all children, students, and staff. Children, students, and staff still self-screen before attending school or childcare every day and stay at home if they are experiencing any new or worsening symptoms of illness. The province is also aligning with changes to community measures, including eliminating cohorting and distancing requirements. And in alignment with community masking requirements, masks will no longer be required of children, students, and staff, or visitors in childcare, schools, school board offices, and or student transportation. Just as in the community, should individuals choose or are required to continue to wear a mask at school or childcare, I would ask that we respect and be supportive of these decisions. The government will continue to provide free masks and personal protective equipment for staff and students that choose to wear them in both school and childcare settings. While these measures are being lifted, the government has also made 3.6 million rapid antigen tests available to school boards and childcare settings every 2 weeks, and these shipments of RATs will continue to support symptomatic testing for students, staff, and children. They will also be provided to staff and students who return from an unplanned absence. Staff and students can also access RATs via participating community supports. This is my last scheduled weekly COVID-19 update, and I want to thank Ontarians for their resilience and commitment to community as we've navigated this global pandemic together. Your sacrifices and collective actions have made a difference. Je tiens à remercier les Ontariennes et les Ontariens pour leur résilience constante et leur engagement envers la collectivité alors que nous traversions ensemble cette pandémie mondiale. Vos sacrifices et vos actions collectives ont fait la différence. I also want to acknowledge that Friday, March 11th, is the National Day of Observance to honor those who have lost their lives because of COVID-19. Over 6 million people globally. To the friends, families, and communities who have lost loved ones, I offer my sincere and heartfelt condolences. I also want to recognize everyone who has been impacted by COVID-19 and thank our dedicated frontline workers for their incredible sacrifices in our fight against this virus. While I may not be delivering updates every week, my team and I remain steadfast in our commitment to protecting the health and safety of Ontarians, and we will closely and carefully monitor COVID-19 trends across the province. We will not hesitate to take action should the situation change, and will inform Ontarians of any significant developments. The lifting of public health and workplace safety measures and the end of weekly updates does not signal that COVID-19 has disappeared or that the pandemic is over. What it means is that we have come to a place where we know what we need to do to manage this virus and to keep each other safe. We need to remain vigilant, we need to stay home when we're sick, and most importantly, we need to get vaccinated and boosted. Vaccination is the best protection against COVID-19 and the best protection for the progress we have made. Bien que cela ne signifie pas que la COVID-19 a disparu ou que la pandémie est terminée, nous savons maintenant ce que nous devons faire pour gérer ce virus et assurer la sécurité de tous. Nous devons rester vigilants. Nous devons rester à la maison lorsque nous sommes malades et par-dessus tout, nous devons nous faire vacciner et recevoir la dose de rappel. La vaccination est la meilleure protection contre la COVID-19 et la meilleure protection des progrès que nous avons réalisés. And thank you. Merci.
I jumped the gun.
Happy to take questions.
Dr. Moore, thank you. We're not doing PCR testing, or virtually no PCR testing. There's no RT value. There's sewage water, yes, but are the masks being removed from our mouths and now being put over our eyes? How are people going to be able to assess their own risk?
So we have very much a robust surveillance strategy in Ontario. We'll continue to have on the ontario.ca website the updates to hospitalization across Ontario, what proportion of those hospitalizations are caused by, and happily the percent is decreasing on a weekly basis. We're now around 45% of admissions are caused by COVID-19. We'll also clearly update the ICU impact from COVID-19. We will be publishing the percentage positivity of the PCR tests that are done, and we still have a robust PCR testing strategy at around 20,000 doses, or 20,000 tests a day, and that percent positivity is remaining relatively stable. As well, on the Ontario Science Table dashboard, they are updating the surveillance from septic. So I do believe we have a robust surveillance strategy. Public Health Ontario will also be publishing the strain and strain dominance, and as you know, the whole genome sequencing remains quite robust. We'll also be partnering with our federal counterparts to understand what strains could be imported into Canada, and we'll be making that information available on a regular basis as well. So I'm confident in our surveillance strategy. Health units for the 34 regions across our province will be updating their websites to inform the public about the overall risk in their communities and the percent positivity and the rate of illness, rate of detection of positivity.
Doctor, how confident are you that you had enough data to make a decision like this on masking?
Well, I think we've been following the trends ever since we've experienced the start of Omicron. So to go back, we peaked around the third week of January in Ontario and have had a peak in hospitalizations in ICU at around 4,000 and 700 admissions to the intensive care unit. Since that time, we've seen slow and steady declines despite opening up. So on the 17th of January, we opened up our schools. On the 31st of January, we further opened up the economy. 17th went to full capacity for most venues, and then March 1st, full capacity for the large venues. So despite that progressive, phased, staged approach, we haven't seen a sudden rebound in cases or impact on the healthcare system. So our strategy has worked. In that meanwhile, we worked very diligently to increase the third dose. So over 7 million Ontarians protected with third doses. And our immunization rate at a population level for 12 and up is around over 90%. So Ontarians have come forward. They've gotten immunized and protected. We now have more therapeutics available across our clinical assessment centers. And despite progressive, phased, and staged reopening, we've not seen a significant rebound in impact on our health system. So I will monitor the situation in an ongoing fashion as we do, but I feel confident that we can do this safely. I also, though, want to encourage all Ontarians to continue to wear masks if they are vulnerable to this virus, if they've got any underlying illness, if they are immune suppressed in any way, and for us to remain kind and considerate to anyone that wants to continue to wear their mask. It is now a choice, not a mandate, and I hope anyone that remains vulnerable will continue to wear their masks.
Dr. Moore, on March 3rd, the Children's Health Coalition, including CHEO and Sick Kids, had asked for you to wait 2 weeks after the return of, after March break in order to lift any other public health measures. I understand that you may have met with them as recently as yesterday. Why was their advice to wait 2 weeks not taken?
Oh, we're in regular conversation with the Children's Health Coalition. I have to thank them for the advice that they provided on an ongoing basis to my office as well as to the ministry. I think they agree that the trends across Ontario are very good, that the risk of hospitalization to children has been minimal, in that very few children have had to be admitted as a cause for COVID and or into the intensive care unit. I think today there's only 3 children across 2.75 million that are in the intensive care unit, and for the vast majority, they're recovering and going back into the community quickly. So I think they've realized the health impact because of our strong immunization strategy. It has been very good and minimized, that the hospital impact has been minimized. They were happy to hear that 91% of high school students have their 2 doses, that 55% of 5 to 11s have had their first dose, and half of them have come forward to get their second dose. So our robust immunization strategy has worked for our schools. They were also happy to hear that we continue to invest in HEPA filters. So 49,000 additional HEPA filters have been purchased and will be distributed across the education sector, that we continue to invest in environmental health cleaning, that we're encouraging every child to screen on a daily basis prior to coming school, that we have one of the most robust RAT strategies with 3.6 million RAT tests being distributed to schools every other week across Ontario. So they were very happy with that strategy. Yes, we'll have debate about when to open, but they had to agree that the impact on our health system, which is what all public health measures are intended to prevent, has worked, that our immunization strategy has worked, and that although there are differences in opinion, the health impact on our system has been minimized.
How can you say that the timeline for all this isn't political when all the measures are basically ending right before the election campaign is going to start?
So I just want to assure Ontarians that my decision-making and recommendations to government have not been affected by any understanding of the political system, that they are based on evidence and science, and that we followed a phased and staged approach. I just outlined the dates that we've followed. We've been doing every 2 weeks that we've had phased and staged reopening. It has gone very safely. This phase, we're waiting 3 full weeks to remove the last measure, which is the masking in public spaces, although I hope all Ontarians will continue to be kind and considerate and allow those that choose to wear a mask to continue to go forward and wear masks, especially if you're vulnerable to this virus.
Didn't want to interrupt.
No, go ahead.
I was just wondering, other than telling people to be kind to one another, have you made any recommendations to the government to make sure that there's no, intimidation with people that decide to keep wearing their mask?
Yeah, I think we have to have a robust education strategy regarding when to wear a mask and who vulnerable individuals to this virus should continue to wear masks. So anyone that has had immune suppression, that's been a transplant patient, that has an underlying chronic illness or is older, should continue to wear a mask. And that communication strategy will be promoted through our local public health agencies, through direct communication to school boards and to the public. And it starts here with this discussion. I want all Ontarians to remain considerate and kind to those that choose to wear a mask. It is a means of protecting each other and reducing personal risk, and it has worked for us in the past.
Dr. Peter Juni has been quoted this morning as saying not only does he think politics may be playing a role here, but he believes this decision is premature. Are you no longer taking advice from the head of the science table, sir?
Well, I'm in regular contact with Dr. Juni. I'm also in regular contact with my team, which is an excellent team within the ministry, and I meet regularly with my federal, provincial, and territorial colleagues, and we just met yesterday. Our plan to remove masking aligns is even more cautious than most provinces if you look across jurisdictions, and it fits along with our phased and staged approach in Ontario that follows evidence, that follows risk, and I think a federal, provincial, and territorial comparison will reveal that we've been quite cautious in removal of these public health measures.
You mentioned the fact, Dr. Moore, you mentioned the fact that we could have to go back to masks, perhaps in the fall when we get to colder weather. What benchmarks would you be looking for before you would do that on a province scale or even a regional scale?
Well, thanks for that question. So we're going to maintain a robust surveillance system going into the fall, and we're going to have a testing strategy that will allow through PCR to detect multiple different viruses. So whether it's influenza A, influenza B, RSV and or COVID-19. And that surveillance system will be put in play through emergency departments and primary care to be able to detect when the viruses start circulating. And if we're seeing multiple different viruses circulating, and we can anticipate those four, which typically each one has a significant impact on the health system to co-circulate, that we would make recommendations to mask at that time. If we see an increasing burden on the hospital system, despite potential immunization strategy for influenza and or for COVID, we may make a move from a recommendation to a mandate for masking. But that would follow data, it would follow the surveillance, the circulation of those viruses, and the impact on the hospital before we'd ever make a recommendation to mandate. And we'd move in a progressive fashion for first informing the public, educating them about the benefits of masking, and then potentially to a mandate.
Why you wouldn't keep this in place for elementary schools where we haven't seen the rate of vaccination that we've seen in high schools? Why not keep it in place longer in elementary schools, Doctor?
So just to reinforce, it's now a choice, and I hope parents choose to mask if their child's vulnerable to this virus. The good news is that over 50%, 55% have had their first dose, and the vast majority of those are going to have their second dose, that the risk to hospitalization of those children from 5 to 11 is quite low, that the measures that we put in place in schools have worked. I'm so happy to announce that we've had only one closure of a school in Ontario of the 4,844 schools as of yesterday, so the measures are working. And I do think that the increase in air quality, the investment in improved ventilation, HEPA filtration, cleaning, as well as the investment of testing for all students will continue to keep our schools safe.
Dr. Uni, what he said this morning was that he'd like to see more data before the decision's made. And I mean, the point I think he made was we've only seen, what would it be now, 7-8 days now since the March 1st loosening. So how can you be confident that we're not going to see a bump from that? We're only barely a week past that movement.
Yeah, so that was only one phase of the reopening. If we go back for our progressive reopening that we've had in Ontario, school openings on January 17th didn't see a significant rise. The reopening of the economy on the 31st of January, the further reopening for 100% capacity on February 17th, we did not see a significant rise in transmission and in cases and or hospitalization. So it's anticipated, we have not seen any significant signals as well since March 1st, and we're monitoring this data on a very close basis, that we will continue, given these trends, not to have any significant rebound like we had in January. The main point has been to prevent the impact on the hospital system. I thank all Ontarians for coming forward for having one of the highest immunization rates in the world. 7 million additional Ontarians have come forward with their third doses, which further protects our hospital system, protects against admission to hospital and severe complications of COVID-19. And I absolutely encourage in the coming 12 days that if you haven't had your third dose, please come forward and get it.
Dr. Moore, what are you going to do on March 21st personally? When you go into a mall, when you meet with coworkers, when you go anywhere, maybe a hospital, what are you going to do? Are you personally going to go mask-free from the 21st onwards, or are you going to continue to wear your mask?
Oh, great question. So in outdoor settings, absolutely, I won't be wearing my mask. I will do a risk assessment for high-risk indoor settings. So if I go to the Eaton Centre, I'll wear my mask. If I'm on the subway, it'll be mandated, and or public bus or streetcar, I will continue to wear my mask in those environments. If I go to a busy box store, I'll put my mask on in those settings. I don't want to give away any of my personal health information, but I'll do my individual risk assessment. And if I'm going into that type of environment where you're not going to have distancing, other people aren't wearing masks, at an individual level, I'll continue.
Why would you do that? Why would you do that? If you're telling 15 million Ontarians it is safe to remove your mask, why would you personally choose to wear your mask if you go to Costco?
It is a choice now, and that's the major change on the 21st, that you can do your individual risk assessment. It's not a mandate. The risk is continuing to diminish, but for some individuals that may be at risk to admission to hospital and or have a negative impact from COVID-19, that's their decision and choice to make, and that's where we move from a mandate to choice.
Moore,
In the lead up to this, you've said many times that you want people to be nice to people who keep wearing masks, and you called today for an education push about that. What are you expecting is going to happen? This is something you've reiterated for weeks, that people need to be nice to people who are going to continue wearing masks. Are you anticipating that there will be harassment? What is the concern here?
Well, I think we've been watching the news internationally and from the United States, where there's an intolerance in some communities and some societies. I would like us to be tolerant of people's individual choices and to realize we're not finished with this pandemic, that the risk of the virus continues, and that we have to acknowledge that some people will be quite concerned with the removal of a mask mandate, and that we should give them the option of wearing a mask and wearing a mask in confidence, that they will be treated with appropriate kindness and consideration, and with no judgments being made. And I think that's an educational piece that we can all work on as a community. I think we've remained very tolerant and kind and considerate throughout this pandemic in Ontario. I would just like to see that continue.
Last question, Dr. Moore. Could you explain what you're recommending in terms of mandatory vaccination policies and why?
So as of March 14th, we have removed any letters of instruction for immunization policies in various venues. So on the 1st, we removed them from the Ontario Public Service, as well as from colleges and universities. On the 14th, we're removing immunization policies in other sectors, knowing that each one of those sectors and private or corporations can adopt their own immunization policies going forward. But a mandate from us to have immunization and or testing is now being removed, given that the risk is less. And in many instances, I want to thank those workers and those environments that have come forward. They have very, very high immunization rates.
Are you now saying that it's actually safe for an unvaccinated person to work in a long-term care home? Because that's one of the mandatory policies that's going to end on the 14th. Like, can you actually explain the science behind that?
So first of all, they have a directive from the minister that they have achieved 100% immunization of 2 doses for all workers in their sector. A significant proportion, I think it's in the 80s, have come forward and gotten their 3rd doses in that sector. The most important component now going forward is maintaining that high level of immunization and immunity, but also adhering to all best practices in infection prevention and control. And I think that has to be operationalized across the long-term care and retirement home sector, and we're going to work with them to ensure that there's a smooth transition from a directive or letter of instruction to operationalizing all the lessons learned from the pandemic.
Thanks everyone, that was the last question.
Wear a mask if you want to be safe, but we've been told the whole pandemic that it works. We're wearing them to protect others. So what's changed about the science now that you'll be protected if only you are wearing one, but everyone else in this room isn't?
So the risk now is less than it was in the 1st, 2nd, or 3rd week of January, and because the risk is less, our public health recommendations have to be proportionate. They have to be balanced, and you have to recognize you can't mandate masking forever, that it has to be eventually an individual choice based on an individual's risk assessment. And we're at that point by March 21st that we're asking Ontarians to do an individual assessment, acknowledging that the risk remains, but that we're well over the peak of activity across Ontario, and we have to learn to live with this virus. Many have been infected already and recovered. Many have had their 3rd doses and are prepared to not have to mask in public spaces. And we have to acknowledge that they have that right now to not have to wear a mask, and that each individual has to do their own risk assessment.